Hi, everyone. Welcome to the second day of our virtual workshop on Pan-Canadian Health Information Exchange Standards. My name is Linda Bird. For those of you who don't know me, I'm an adjunct assistant professor here at the University of Victoria and the instructor for the UVic HIMP 537 course on Health Information Exchange Standards, which is hosting this three-day workshop series. So welcome, everyone. But before we get started, let's begin with our territory acknowledgement. We would like to acknowledge and respect the Lekwungen, Songhees, and Coseps Esquimalt peoples on whose territory the university stands, and the Lekwungen and Wasanich peoples on whose historical relationships with the land continue to this day. So we had a fantastic workshop yesterday focusing on HIE standards and also social determinants of health. We learned all about the Pan-Canadian Health Interoperability Data Content Framework. And I'm really looking forward to what day two has in store. We're in the middle of the overall program, and today's focus is on Canada Health Infoway's data standards. Following the presentations at around 6:30 p.m. Pacific, the students in our HIMP 537 course will continue on and we'll be doing some hands-on activities. So today we're going to be mapping between exchange standards, mapping between terminologies, and also creating some SNOMED CT value sets on allergy and intolerance data elements using the ECL query language, which I think is going to be fun, and I hope the students do too. So if you're wondering how you can join the fun too and get some hands-on experience to better understand these interoperability standards, you can enroll in the University of Victoria's Certificate in Health Terminology and Interoperability Standards. This is a one-year part-time program with 4 graduate level courses done through weekly online evening classes, plus this virtual workshop. This is the only terminology standards program in Canada that is accredited with CHIMA, the Canadian College of Health Information Management, to become a certified terminology standards specialist in Canada. So if you'd like to join our September 2026 intake, please apply by June 15th. And to find out more, you can either scan this QR code or visit us at uvic.ca/hinf. But coming back to the workshop agenda, so here is today's lineup. We have 6 wonderful guest speakers from Canada Health Infoway today. We have Tarek Kadoura, Janice Spence, Julie Button, Miriam Talantiki, Sonia Balgar, and Alex Rees. But first up, Tarek Kadoura will be introducing us to the Canadian Standards Release Centre, which is advancing interoperability in Canada through standards development and application. Tarek is the Director of Business Operations in the Connected Care Department at Canada Health Infoway based in Toronto, and there he leads the Canadian Standards Release Centre. Tarek has over 20 years of experience in healthcare and retail, focusing on operational efficiency, interoperability initiatives, and health data standards. He is experienced across software development lifecycle and information technology infrastructure library frameworks, bridging business and technical teams to deliver practical solutions in digital health. He is a member of HL7 Canada, IHE Canada, and the ISO TC215 Health Informatics Committee. Tarek has a Bachelor of Science in Business Administration. He is a certified Scrum Master. He's a certified in the ITIL Foundation and has an intermediate certificate in IT service transition. So with that, I am delighted to introduce you to Tarek Kadoura, who is going to talk about the Canadian Standards Release Centres. I will pass the floor to you. Thank you so much, Tarek.
Oh, thank you for the introduction, Dr. Bird. Let me just share my screen here. Okay. Let me know if you can see my screen in a presentation mode, please.
That's wonderful. Perfect. Thank you.
All right. So I will actually be presenting on behalf of the Canadian Standard Release Center, and then I'll hand it over to Alex for the rest of the presentation. All right, so with that, Canada Health InfoWay. As a matter of fact, most people just say InfoWay. And just before I get into the work that my team does, I just want to take a few moments here to set some context about who we are and where we sit, because I think that's really connects everything that you'll hear today. So InfoWay is an independent, not-for-profit organization. We are funded by federal government. We are not a government department, and we are not a vendor. We somewhere sit in between, so that actually position us in a way that allows us to bring provinces, clinicians, and industry together and stay focused on what actually matters for the health system. If you look at our vision, it's very simple. It's healthier Canadians through innovative digital health solutions. And our mission is basically about using digital health to make care more connected, more accessible, and everything is obviously around or centered around patients. And this is essentially how we decide what to work on. All right, so I think that gives you a sense of who we are. I'd like to talk now about what we actually do. So at InfoWay, we work across provinces, territories, clinician, and industry to align on common standards and how health data gets shared. This is all guided by our pan-Canadian interoperability roadmap. So if you look at the diagram on this slide, on the left, you'll see the foundation work, and essentially in simple terms, that means it's all about helping everyone to use the same rules, the same definition when sharing the health data. In the middle, you will see coordination along with the objectives. This is basically where we bring clinicians, government, industry together to be clear about how health data should be shared. And finally, on the right, you'll see the impact that we basically are after, which is better care, safer care, and data that can actually be used for public health and research. So all in all, when you look at this slide, if you put everything together, the logic is really simple. At InfoWay or InfoWay in general, we do coordinate the standards, the data exchange, the conformance at a national level, so the health information can be shared and can also be understood and reused safely, I should say. Okay, moving on to the next slide. Okay, so Canadian Standard Release Center. This is where my team fits, the CSRC or the Canadian Standard Release Center. If you look at InfoWay as an organization, at the national level, we focus at what needs to happen. And as I said, that's at the national level. But if you look at the CSRC, we focus on how this whole thing actually happened, essentially how standards are developed and adopted and how we make interoperability possible. Right, so going a little bit more into the Canadian Standard Release Center or the CSRC. So the CSRC is essentially part of InfoWay. The focus is specifically on standards. Our job is to support the adoption of pan-Canadian and international standards, so digital health system can essentially talk to each other and, more importantly, actually keep the same meaning when they exchange the data. We do publish and maintain and translate health terminology and data exchange standards, and we deliver national releases so everyone across Canada is aligned on the same approved standards. So this is really about, the shared understanding, because in healthcare, that's very important because that can affect real people. All right, moving on to the standard services that we provide. Here we have the main standard services that the CSRC provide. I'll go through them at a high level, but just wanted to call out that our goal isn't just to publish standards. It's actually more to make them more usable and also operational. Okay, so if you look at the first thing that we do, and one of the main pillars that we do as part of the CSRC is the publication and the distribution. We release Canadian standards like SNOMED CT-CA, the Canadian edition, LOINC, the Pan-Canadian LOINC, which is the PCLOCD, and the CCDD, which is the Canadian Clinical Drug Dataset. All this are done in both English and French, and this is essentially a work that never really stops. It's an ongoing work. We do more than 18 releases a year. So as you can probably appreciate, it's a long-term commitment, not just a one-time thing. Second is the terminology services. We do operate a national terminology server, which is Fire-based services and API. This is essentially lets the system connects to one authoritative source instead of maintaining their own local copies of codes or value sets. And that is very important to make data exchange more predictable and reliable. The third thing that we do is the support and education. We do provide guidance, and I think part of our participation here falls under this third pillar, I would say. We provide guidance, training, and we do support the community and organization to understand how to apply standards correctly in practice. That's not where we stop, and we do actually stay engaged to support the adoption beyond the release or the releases itself. And finally, we do represent the Canadian needs in international standards organizations like HL7 International, LOINC, and the SNOMED International to align with the global standards. So overall, I would say these services help turn standards into something practical and usable. And really all of this work is massive. What I mean by that, interoperability at a national level is not an easy thing. It does take expertise, collaboration, and definitely doing things properly over time. And quite frankly, much of this work happens behind the scenes, but it's what allows health data to be shared and trusted across Canada. So on that note, I'll hand it back to Dr. Bird. Thank you so much for having me. I'll continue to present the rest of the slides for the Canadian Standard Release Center before I hand it over to Alex. And I do really hope that you take a lot away from today's workshop.